the work of the kidneys, which includes removing excess water and removing some metabolites in our body, urea, creatinine, some things that the body does not want excess of. Good day, everyone. My name is Patience Obiawgu. I am a professor of pediatric nephrologist with Aminu Kano Teaching Hospital, Kano.
A new idea of dialysis called peritoneal dialysis has emerged, and Dr. Patience Obiawgu of the Aminu Kano Teaching Hospital, a professor of pediatrics, is here to explain.
Peritoneal dialysis works for both conditions, but if kidneys fail to work, if kidneys fail, these things will remain in the body. Excess water remains in the body. Excess of those metabolites remain in the body, and they cannot leave the body. So the person continues to swell up, essentially. So peritoneal dialysis, which is one of the forms of dialysis, cleaning the blood essentially, helps to remove this excess water and excess unwanted materials in the blood. So what people really know will be the haemodialysis, which is the same thing where the blood is essentially filtered or cleaned through the blood. Whether the person is hooked to a machine, some tubings are passed, and it is done through the blood. But peritoneal dialysis is done through the abdomen. In that case, a soft tube, which we call a peritoneal dialysis catheter, is put inside the abdomen by the patient's bedside or in theater, as the case may be. Some fluid is put into the abdomen. The fluid is let to stay for some minutes or hours in the abdomen. Now, the time depends on what one is treating. And after that time, the fluid is let out. Now, this fluid, while it is inside the abdomen, it helps to remove the excess metabolites that are not wanted in the blood. So that exchange happens through the peritoneum, which is our own God-given filter in our body. In hemodialysis, a dialyzer, an outside dialyzer is used. In peritoneal dialysis, our bodies have this peritoneum, which serves as the filter through which the rubbish is removed, and that fluid that is put into the abdomen is let out, and these excess things are let out. So that is essentially how it works. It can be like this manually, or it can be automated, meaning that it can be connected. It's a life-saving procedure, particularly when we talk of acute kidney injury, the short-term one, where the person, whether a child or an adult, has a situation which is so life-threatening that you need to filter the blood practically immediately. So this is a procedure that can be done exactly anywhere, whether in a hospital. For acute, of course, acute kidney injury is a severe illness in which it has to be managed in the hospital. So that's done in the hospital. It doesn't need a special facility for it to be taken care of. We've treated very many patients with acute kidney injury using peritoneal dialysis. Now, this is particularly in children because adults have not been using this procedure, particularly in this part of the world, many parts of the country, and also including our parts. I've treated, we've dialyzed over 30, 40, I can't even keep count, children, and the outcomes have been excellent. I would use the term excellent, not just good, because our children recover very well from their disease condition, which is acute kidney injury. We don't have the consumables or tubings and dialyzers for small, very small children who have acute kidney injury to be able to hook them up to the hemodialysis machine. So peritoneal dialysis is a gentler form which the children can be connected to manually. The disease condition progresses to become very long-term chronic kidney disease, needing lifelong dialysis or kidney transplant or death. So we've had excellent outcomes. Our children survive acute kidney injury requiring dialysis very well, except of course if the condition is so critical that now this is not the dialysis, the problem of the dialysis, the disease condition itself can be so severe as to take. And I've treated people elsewhere, not in this country where I trained, and we also have those that are on chronic dialysis, meaning they are on long-term dialysis. They have their dialysis sessions in their homes. They don't have to come to hospital for anything. They dialyze from the house. They come to hospital only once in a month for their regular checkup, clinic. They don't have to come 3 times a week like you have to do in hemodialysis. They don't deal with needles, because in hemodialysis there are times when you have to put in needles. Transport costs are taken out. As long as the caregiver is taught how to care for this person, peritoneal dialysis is comfortably done at home. But for acute kidney injury, it can only be done in the hospital, because it's an emergency kind of situation. Unfortunately, we do not have enough skilled manpower, doctors or nurses. We do not have enough of them. Pediatricians are the ones that have been doing peritoneal dialysis in different centers. Not all are trained yet, but in adult medicine, there are just a couple of doctors, not in this center, somewhere down south, that do peritoneal dialysis. We do not have manpower, we do not have trained nurses. Many times we do not have even the consumables to use, and we have to improvise. We do not require a machine, but of course if there is the machine, which we call the cycler, it helps to reduce the time the doctor or the nurse would have to spend on the patient doing the exchange. You remember I said we put water in, we let it stay, we open to let it out. If there is a machine, it can do all of that by itself without requiring anybody to come and do the exchanges. So it is absolutely more cost effective than hemodialysis. A major way of doing that is training. We have to train doctors, nurses, other staff in the procedure of peritoneal dialysis for them to know about it and to be able to do the procedure. Here we've trained many. During some conferences, we've been able to organize workshops and trained over 120 doctors and nurses, including some come from neighboring countries, not only in country. I've had doctors come from Niger to come learn the procedure, hands-on workshop. All the workshops are hands-on, so that these doctors and nurses would be able to practically do the procedures when they get back to their centers. Because our doctors here, where they're in training, those that we've trained, they go elsewhere, they do these procedures, and that's a way to bridge the gap. Another one is partnerships. It's not easy to come by the consumables needed, and the training workshops themselves are pretty expensive. So partnerships with some organizations, non-governmental, international, academic associations also partner and help in training doctors and nurses. It's important that we get government support as well, because the dialysis sessions, many times our people are also, despite the fact that it's more cost effective than hemodialysis, our people are also finding it difficult to buy the consumables or pay for the service. So if, for example, it is in the health insurance scheme, the way some sessions of hemodialysis is in the insurance, it could help. It could help. And with longer term use of peritoneal dialysis, the consumables will become more in demand and thus go cheaper. There is a lot of demand and supply. So with frequent use, frequent requests, we have local manufacture of the dialysis fluids in country. That is something that has made it even cheaper than before when we had to import the dialysis fluids. So, but now we have a company that manufactures it locally. It has helped to cut down the cost of peritoneal dialysis significantly. And it's also important for us to, let people know that there is this option. There is this option, not only hemodialysis. If you do not want to go through that, you have this other option, and let them know about it, and they can make a choice, a very well-informed choice on their own, particularly for those on long-term dialysis. I teach peritoneal dialysis to students that's in lecture format. There are many students that we have to teach that, but that's in lecture format. The practicality of peritoneal dialysis is taught to doctors and nurses, not students. But yes, I teach students during my lectures, of course, so that they would also know, apart from hemodialysis, they know there is peritoneal dialysis. It's been there for a very long time. It's just that it was downplayed over the years, so some people have no idea about it. I will teach it to students, doctors, nurses, anybody that learns. You can save a life. You can be in a worse situation. We've had situations where, like COVID situation, it was difficult to do hemodialysis because there is very high risk. Peritoneal dialysis saved many countries that do it from problems. So if you have things like that, and in our very small children, newborns, under 5s, under 1 year old, that their kidneys fail from any condition such as diarrhea, malaria, these things can make kidneys fail acutely. You can easily do peritoneal dialysis for them. The alternative for them may be death. So if we can save some, why not?